Okay, so this is the fourth interview for the MVP eye drop compliance device. This is Nathan, one of our TACSET ophthalmic associates. He's been doing this for quite a while, sees patients who are chronic eye drop users and acute eye drop users for multiple reasons, multiple disease pathologies. So we're gonna just interview Nathan and see what he thinks of this device. I haven't told him much information, and just kind of want you to ad-lib. And thank you for taking the time to speak to us. We're interested in understanding how taking the eye drops would affect the patients that you see and that you take care of, and that you collect data from. And you're open to sharing your experience today. Is that right?
Yeah, absolutely.
Thank you, Nathan. Thank you. Okay, so I'm going to ask you to turn on the eye drop compliance device.
Okay.
Perfect. So it just so happens that it's 8 a.m. in the morning, and this is either on your bed, your nightstand, or in the bathroom, and it's flashing red. It's telling you that you need to take your drop. So, if you would describe what you think the purpose of this and how it would affect your compliance, and just
I think it's a great idea just in terms of it's hard to miss, especially if you're keeping it somewhere like that. I think like with a lot of people we have a lot of like non-English speakers where language barriers are a major issue even with written instructions, so I think this helps get you over that hurdle. Even more so when you're following up with those types of patients where either because of those issues or just maybe just compliance, like you don't have to worry about getting misinformation yet. Yes, I've been taking it twice a day, but have you, when you can see pressure spikes or, different symptoms that aren't being addressed in the way that they should be by the medication therapy. So I think I love the idea of the accountability factor in that it measures the quantity of the bottle as it goes down. And so, yeah, I think like from a healthcare standpoint, it really helps a lot of physicians because it takes a lot of those questions out of it. And it seems like it would be really easy to use. I mean, it's pretty straightforward. It flashes when you need to use them and stuff, and yeah.
And so after you would use it, you'd replace it. It would then indicate with a green light that you've successfully taken the drop.
Yeah.
And then it would continue on. So can you think of any other pain points for patients that come to mind?
As far as like advantages to using it, or
advantages, disadvantages, just some thoughts, free thinking.
I mean, I guess the only thing would be I don't know. As I understand it, I think it's an easy to use idea. The concept seems like something that a lot of our patients would benefit from having.
Right. And you don't know of any device or any other methodology that's similar to this, right?
Not at all. I mean, most of our patients set alarms on their phones, which that addresses the timing, but this is like a whole nother level because it's actually addressing compliance. And like, yeah, an alarm can go off and you can be cooking or doing 1,000 other things, and this actually is making sure that you're taking it. Or if you're not, it's letting the doctor know so that they don't adjust their therapy, because I mean, so often you run into that issue where the providers are like, okay, well, it's not working and you're saying you're doing it right, so let's try this other drug or let's modify your therapy when that might not be necessary or indicated, So,
perfect.
Yeah.
Great. So, anything else, Nathan, or?
I don't think so. I think it's a great idea.
Good. So, what do you think a price point would be for a device like this for our patients?
Gosh, I don't even know. Like, after insurance, like what would the copay would be for them, or?
Say after the insurance, but what do you think a manufacturer would charge for a device like this?
I mean, so it's track of time. Ugh. I mean, I think like to get a scale in there that would be like accurate enough, I couldn't say. I mean, I'd say probably like 500 or something. Like, I don't know.
So just to let you know, so we're thinking more in the line of $20, $25, because most of these folks are fixed income, they're elderly.
Right.
And you know, we sort of modeled it around a Fitbit.
Right.
Fitbit could be anything from 75 for the generic Fitbit to the real one. It could be up to 200. And you know, 500, I mean, for a one-time purchase might work. But really, again, when you think back to who these folks are, I think $20-$25 is more in line. I mean, you know, they complain when you give them a bottle of Zolotan or prescription. They always want generics, right?
Mm-hmm. Yeah, I feel like this is probably something that insurance wouldn't cover anyway. I mean, I could see it being a battle to get them to cover it because they consider it maybe like unnecessary. It's like, well, just get them to take the drops, right? You know, so I could kind of see that running into that issue. But on the other hand, I'm looking at like even something like a blood pressure cuff, you know, and that's a fairly simple everyday standard device, and those still can cost like $60 or over what we're talking about. I mean, I just paid like $200 for a knee brace, you know, so I don't know. It's just durable medical equipment. I mean, that'd be amazing. I think it'd fly off the shelves if it were that much, you know.
Yeah.
For
Great,
sure.
Great, perfect. Nathan, thanks so much.
Sure.
All right. Good.